everyone. Today I'll be talking about the blood supply of the brain. Although the brain is only 2% of the body by weight, it receives approximately 20% of the body's blood and 25% of its oxygen. The brain cannot store oxygen or glucose, so it relies entirely on this continuous supply of blood. Interruption of this supply has immediate consequences, including loss of consciousness within 10 seconds, ceased electrical activity after 20 seconds, and irreversible damage within a few minutes. Because of the high metabolic needs of neuronal cell bodies, blood vessels are more densely packed in gray matter. The brain's cortex is supplied by three major arteries. The middle cerebral artery, or the MCA, supplies most of the lateral surface of the frontal and parietal lobes. It travels through the lateral fissure and typically supplies the hand and face regions of M1 and S1, or the primary motor and primary sensory cortex. The anterior cerebral artery, or ACA, supplies medial regions of the frontal and parietal lobes. It travels through the longitudinal fissure and typically perfuses the leg and foot areas. Lastly, the posterior cerebral artery, or the PCA, supplies the inferior temporal and occipital lobes, including the primary visual cortex, or V1. The circle of Willis is a loop of arteries at the base of the brain that connects the internal carotid and vertebrobasilar systems. The middle and anterior cerebral arteries come from the internal carotid, while the posterior comes from the vertebrobasilar system. These two systems are linked by the anterior and posterior communicating arteries, which form the circular structure. This arrangement allows for anastomoses, or connections between vessels, which act as a protective mechanism and redirects blood flow in the event of a blockage. Interestingly, only about 20 to 25% of people have a complete circle of Willis, so its compensatory abilities vary. Besides the major arteries, there are smaller perforating arteries that branch off from the circle and supply deep brain structures like the basal ganglia, thalamus, and choroid plexus. Cerebral autoregulation refers to the brain's ability to maintain a constant blood flow, despite fluctuations in the system's blood pressure. They dilate when the pressure drops and constricts when pressure rises, and this mechanism helps protect the brain tissue by steadily supplying oxygen and nutrients to the brain. The brain receives about 850 milliliters of blood per minute, with roughly 350 from each carotid artery and the remaining 100 from the basilar artery. This graph shows that autoregulation is effective when the mean arterial pressure stays between 70 and 160 mmHg. Outside of this range, blood flow can become pressure-dependent and potentially harmful. Cerebrovascular diseases and accidents, also known as strokes, are among the leading causes of neurological deficits. A stroke occurs when there's a sudden interruption in the brain's blood supply, typically due to ischemia, or a lack of oxygen-rich blood. The most common type of stroke is ischemic stroke, which happens when a blood clot forms in an artery leading to the brain. A hemorrhagic stroke, also known as intracerebral hemorrhage, occurs when a blood vessel ruptures, leading to the bleeding within the brain tissue and compression of nearby structures. A subarachnoid hemorrhage also involves a ruptured vessel, but bleeding occurs in the space surrounding the brain rather than within. Lastly, a transient ischemic attack, or TIA, is a mini-stroke, and the symptoms are similar to a stroke but resolves within an hour. They're typically warning signs of future strokes. Damage to different cerebral arteries leads to distinct clinical symptoms based on areas they supply. A stroke in the middle cerebral artery often causes contralateral motor and sensory deficits involving the face and upper extremities. If the anterior cerebral artery is affected, deficits are more restricted and involve contralateral leg and foot deficits. And a stroke in the posterior cerebral artery usually results in visual deficits since it perfuses the occipital lobe, which houses the visual cortex. A detailed understanding of the brain's vascular supply is crucial not only for diagnosing and treating neurological disorders, but also for preventing damage during surgeries. In IOM, where the goal is to preserve the brain's functional and structural integrity, knowing which territories are perfused by which arteries allows for rapid interpretation of intraoperative changes, helping guide critical decisions in real time and ultimately improving patient outcomes. These are my references, and thank you.